8 common medications that can damage your kidneys. The kidneys play a vital role in filtering waste products and excess fluids from the blood, maintaining electrolyte balance, and regulating blood pressure. However, certain medications, while essential for managing various health conditions, can inadvertently harm kidney function. Understanding the potential risks associated with these medications is crucial for healthcare providers and patients alike. From common pain relievers like NSAIDs to antibiotics, antidepressants, and chemotherapy drugs, several classes of medications have been linked to kidney damage. By recognizing these risks and implementing preventive measures, such as regular kidney function monitoring and appropriate medication management, healthcare professionals can help mitigate the adverse effects on kidney health and ensure optimal patient care. 1. Non-steroidal anti-inflammatory drugs. These medications, commonly used to alleviate pain and reduce inflammation in conditions like arthritis, headaches, and menstrual cramps, can have detrimental effects on kidney health if not used cautiously. While they are effective in managing pain by inhibiting the production of prostaglandins, which are involved in the inflammatory response, NSAIDs can also interfere with the normal functioning of the kidneys. They work by inhibiting enzymes called cyclooxygenases, which play a role in regulating blood flow to the kidneys and maintaining the balance of electrolytes and fluids. Prolonged use or high doses of NSAIDs can disrupt these regulatory mechanisms, leading to decreased blood flow to the kidneys and impairing their ability to filter waste products from the blood. This can result in conditions such as acute kidney injury, AKI, or exacerbate pre-existing kidney conditions, such as chronic kidney disease, CKD. Individuals with pre-existing kidney issues, hypertension, or heart failure are particularly susceptible to NSAID-induced kidney damage and should consult their healthcare provider before using these medications. 2. Certain antibiotics. While antibiotics are essential for treating bacterial infections and saving lives, some types can pose a risk to kidney health if not used appropriately. Certain antibiotics, such as aminoglycosides, for example, gentamicin, tobramycin, and polymyxins, for example, colistin, are known to be nephrotoxic, meaning they can directly damage kidney tissue and impair kidney function. These antibiotics are often reserved for treating severe infections when other options are not available due to their potential side effects. Additionally, some antibiotics, including vancomycin and sulfonamides, can cause kidney damage by inducing allergic reactions or forming crystals in the kidneys, leading to conditions such as acute interstitial nephritis or crystalluria. It's important for healthcare providers to carefully consider the risks and benefits of antibiotic therapy and monitor kidney function closely, especially in patients with pre-existing kidney conditions or those receiving multiple nephrotoxic medications. 3. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are widely prescribed medications used to treat gastrointestinal conditions such as gastroesophageal reflux disease, GERD, peptic ulcers, and gastritis by reducing the production of stomach acid. While PPIs are generally considered safe and effective for short-term use, long-term or inappropriate use of these medications has been associated with an increased risk of kidney damage and chronic kidney disease, CKD. The exact mechanism underlying PPI-induced kidney injury is not fully understood but may involve alterations in renal blood flow, inflammation, and impaired kidney function. Studies have shown that prolonged PPI use is associated with a higher risk of developing CKD, particularly in older adults and individuals with pre-existing kidney conditions or other risk factors. Healthcare providers should exercise caution when prescribing PPIs, especially for long-term use, and consider alternative treatment options or periodic monitoring of kidney function in at-risk patients. 4. Antiviral medications. Antiviral medications are used to treat viral infections such as HIV/AIDS, hepatitis B, and hepatitis C by inhibiting viral replication and reducing viral load in the body. While these medications have significantly improved the prognosis and quality of life for patients with viral infections, some antiviral drugs can have adverse effects on kidney function. For example, certain nucleoside/nucleotide reverse transcriptase inhibitors, NRTIs, used in the treatment of HIV/AIDS, such as tenofovir and didanosine, have been associated with renal toxicity and kidney damage. These medications can cause proximal tubular dysfunction, leading to electrolyte imbalances, proteinuria, and decreased kidney function. Close monitoring of kidney function is essential for patients receiving antiviral therapy, and dose adjustments may be necessary to minimize the risk of kidney-related complications. 5. Anti-retroviral drugs. Anti-retroviral therapy, ART, has revolutionized the treatment of HIV infection and transformed it into a manageable chronic condition. However, some antiretroviral drugs used in ART regimens can have adverse effects on kidney health. Certain protease inhibitors, such as indinavir and atazanavir, have been associated with nephrolithiasis, kidney stones, and kidney damage due to their tendency to crystallize in the urine and cause obstructive uropathy. Additionally, some non-nucleoside reverse transcriptase inhibitors, NRDs, and integrase inhibitors used in ART can cause renal tubular dysfunction and impair kidney function. Regular monitoring of kidney function, including serum creatinine and urine protein levels, is recommended for patients receiving ART to detect early signs of kidney damage and adjust treatment accordingly. 6. Certain antidepressants. Antidepressant medications, particularly selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed for the treatment of depression, anxiety disorders, and other mental health conditions. While SSRIs are generally well tolerated and effective, some studies have suggested a potential link between long-term SSRI use and adverse effects on kidney function. The exact mechanism underlying SSRI-induced kidney damage is not fully understood but may involve alterations in renal hemodynamics, electrolyte balance, and tubular function. It's important for healthcare providers to monitor kidney function in patients receiving long-term antidepressant therapy, especially those with pre-existing kidney conditions or other risk factors. Additionally, patients should be educated about the importance of staying hydrated and avoiding excessive use of over-the-counter pain relievers, which can further exacerbate kidney problems in conjunction with antidepressant medications. 7. Diuretics. Diuretics, commonly known as water pills, are medications used to increase urine output and reduce fluid retention in conditions such as hypertension, heart failure, and edema. While diuretics can be effective in managing these conditions and relieving symptoms of fluid overload, they can also have adverse effects on kidney function if used improperly or in excessive doses. Diuretics work by altering the reabsorption of sodium and water in the kidneys, leading to increased urine production and decreased extracellular fluid volume. However, prolonged or excessive use of diuretics can lead to dehydration, electrolyte imbalances, and impaired kidney function. Loop diuretics, such as furosemide and bumetanide, are particularly potent and can cause electrolyte disturbances such as hypokalemia and hypomagnesemia, which can predispose to kidney injury. Healthcare providers should carefully assess the risks and benefits of diuretic therapy and monitor kidney function and electrolyte levels regularly in patients receiving these medications. 8. Chemotherapy medications. Chemotherapy drugs are used to treat various types of cancer by killing rapidly dividing cancer cells throughout the body. While chemotherapy can be highly effective in shrinking tumors and improving survival rates, it can also have toxic effects on healthy cells and tissues, including the kidneys. Some chemotherapy agents, such as cisplatin and methotrexate, are known to be nephrotoxic and can cause acute kidney injury, AKI, or chronic kidney disease, CKD, as a result of their direct toxic effects on renal tubular cells. The risk of kidney damage depends on factors such as the type and dose of chemotherapy, the duration of treatment, and the patient's underlying kidney function. Healthcare providers should carefully monitor kidney function before, during, and after chemotherapy treatment and take steps to minimize the risk of kidney-related complications, such as administering intravenous fluids. In conclusion, understanding the potential adverse effects of medications on kidney health is essential for both healthcare providers and patients. While medications like NSAIDs, antibiotics, and antidepressants are crucial for managing various health conditions, they can inadvertently harm kidney function if not used cautiously. Regular monitoring of kidney function, particularly in high-risk individuals, along with appropriate medication management, is key to preventing medication-induced kidney damage. Moreover, patient education about the importance of hydration, lifestyle modifications, and adherence to prescribed medication regimens is paramount in supporting kidney health. By prioritizing proactive measures in patient-centered care, healthcare professionals can effectively mitigate the risk of medication-related kidney damage and promote overall well-being. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go. Thank you for watching.